delighted to introduce Tracey Dennison. Tracey is a consultant nurse practitioner at East Riding Aesthetics and Wellness. I'm going to be talking to us about something maybe a lot of you haven't heard of. It's around something called lifestyle medicine and how that can be applied to optimize skin health and wound healing using its principles. So I'm sure this is going to be a fascinating session. Over to you, Tracey. Thank you.
Thank you, Sarah. Thanks for the lovely introduction. Hello, everybody. It's really nice to be here. Nice to see so many people logged on. So I'll just give you a tiny little bit about my background and then we will crack on. So I am a nurse. I've been a nurse for over 33 years and I did over 30 years NHS. So I kind of put a shift in, and these days I predominantly work in private practice, a lot around skin health, and I am registered with the British Society of Lifestyle Medicine, which is something that I would encourage everybody to look at. It's an absolutely fascinating side of medicine, and it impacts on all different areas of our clinical practice. So we're looking at how lifestyle medicine and skin integrity intertwine and work together. Sorry, I'm just getting it to move on. So some of this will flow beautifully from the previous presentation, but we're going to look a little bit about medication and how that affects the skin. We're going to look around the brain, the gut and skin axis, which is fascinating and really deserves attention. And really understanding how the vagus nerve, how the microbiota all affects our skin health. We're going to look at some lifestyle strategies to support that as well, and some clinical applications. So why proactive beats being reactive? I appreciate a lot of people are in an NHS world, and in an NHS world, we are under-resourced, we are firefighting, and we are generally having to meet problems as we find them. Lifestyle medicine starts upstream. So we need to be thinking about how we work in a preventative way and how we can manage patients way before issues become a problem. We know chronic wounds are very expensive, but they are avoidable with the right treatment, the right care, and the right foresight. We know if we prevent the wound incidence, then we reduce the overall healthcare burden on the NHS. Chronic wounds are expensive, aren't they? So we need to be anticipating problems before they begin and mitigating for them at that point in time, or even earlier if possible. So skin. I don't need to tell anybody here that skin is the biggest organ in our body. So it is our early warning system. What's happening in the rest of our body is often reflected in our skin. It is going to tell us if there are issues like malnutrition or suboptimal nutrition. It's going to tell us if a patient is immobile, because we're going to start to see that pressure damage, aren't we? If there's vascular disease going on, we are going to be able to visualize it. So all of these things, they start upstream, and we need to recognize these signs as an early red flag. But ideally, what we need to be doing is stopping these problems before we even get to that red flag stage. So when it comes to lifestyle medicine, there are 6 pillars that we do all of our assessments against. These are brilliant in so much as they give us a really good structure and a really rounded approach to properly holistic patient care. I think over the years, I was actually having this conversation yesterday with a colleague around how we have all specialised. If we go back about 50 years ago, we would have a general surgeon, wouldn't we? And that general surgeon might be operating on breasts, might be operating on appendices, and then potentially fixing bones, because they did everything. And now we have specialised, and then we have super specialised, which is great because we are really expert in really specific things. But what it does mean is that we have lost this bigger perspective, and we need to be bringing in all of that into everything we do. So we need to be looking at nutrition, and it's a really easy thing to say. But if I sit with my patients and say to them, what's your diet like? They'll say, oh yes, really healthy. Do they know what really healthy looks like? We need to unpick that. We need to unravel that. What does healthy mean to the patient? Is it a plate full of carbs with a tiny bit of protein and a little bit of fruit or vegetables on there? Because that's what it means to an awful lot of people. And the effect that that kind of level of macros, when we're looking at nutrition, gives us is probably going to give us very high blood sugars, very high levels of inflammation that we've just been talking about, and potentially stepping our patients into the world of diabetes if they're not already there, with all of the skin problem that brings along with it. So we need to be experts in nutrition. We really need to understand this and unpick it. It's an onion, pardon the pun, in itself, because that's nutrition. But it really is an onion, and you can go deep with this, and it is very worthwhile doing. Obviously, mobility even, and patients' physical activity, the more they're moving, the better their skin quality is going to be. We look at sleep and circadian health. Sleep is the bedrock of everything. If we are not asking a patient how well they are sleeping, we're in trouble, because their skin is going to be healing and repairing. Their whole body system is going to be healing and repairing during that sleep phase. We're missing a trick if we're not discussing it with them. Stress and psychological well-being. Well, stress again causes inflammation, doesn't it? High levels of cortisol, being in a continuous state of fight or flight rather than rest and digest. We have whole body systemic inflammation caused by that. If we've already got other unhealthy inflammatory processes going on, bearing in mind we do need some inflammation, then that could just tip over the edge and cause us even more problems. So, how are we supporting patients with their stress and their psychological well-being when they're coming to us with their skin problems? Avoidance of risky substances. Yes, we know, that smoking and alcohol isn't great for you, but what about sugar? We need to be discussing all of these things with patients as well. And something that often gets forgotten is the social and spiritual connection. It's vital when we're looking at lifestyle medicine, but it's also a really important factor when we are talking about skin health. So let's dig a little bit deeper. Malnutrition presents in up to 50% of at-risk patients. So these are patients that are at risk of various kind of comorbidities. So we really need to be digging deep and understanding what nutrition means to them. If they're eating lots of inflammatory foods, which is obviously anything that is sort of sugar based, but anything that is wheat flour based as well is highly inflammatory, will shoot the blood sugar levels up. So anything, pasta, bread, refined rice, white carbs, they're all going to be causing lots of inflammation in the body. And a lot of those things patients think are healthy. So we really need to understand what nutrition means to them. We need to screen them properly. We need to refer them to dietetics if we are finding that they trigger for that. And we need to give the balanced food intake. And that really does help with the skin function, barrier, and all of the things that we really need to improve skin health. Making sure that we know what that actually looks like is really, really important. Not just asking the question of, do you eat a healthy diet? So, like I said, we've got lots of causes of inflammatory processes in our diet itself. The predictable things, the sweets, the crisps, the cakes and bread and things like that. But say that the pastas and the rice is also very much in there. Anything like that is just going to convert straight into a high blood sugar with very little nutritional content for us. And the high blood sugars will fuel inflammation. If we've got inflammatory processes already ongoing elsewhere, then we're adding fuel to the fire. So how can we reduce systemic inflammation from a dietary point of view? Well, this is just a couple of different ideas, really, but berries and cherries, highly anti-inflammatory, low glycemic index, full of fibre, lots of benefits for patients eating those. Different herbs and spices are really good for anti-inflammatory properties as well. So curcumin, turmeric, are renowned for being highly anti-inflammatory, as much as ibuprofen in many of the studies, provided they are cofactored with the right products. So turmeric, for example, will only be absorbed if we are combining that with good fats or with black pepper. So if people are taking it as a supplement, then usually in those supplements you will see that black pepper is an added component. That's not for any other reason than it actually helps with that absorption and therefore helps reduce inflammatory processes systemically using our diet to do it. So when we're talking about mobility, I'm sure nobody needs me to tell them that patients need to move to avoid pressure sores. We know all of this, don't we? But we need to build in even micro movements. All the little movements really, really matter. So encouraging just those small movements, hands, feet, repositioning, seated exercises, and getting the right physiotherapy involved where possible and indicated is really important. But we really need to be tackling this before patients become in a state where we're noticing pressure damage starting to occur. Sleep, like I said, is absolutely vital. Sleep deprivation will slow repair, it will increase inflammation and inflammatory processes. So, maintaining a patient's circadian rhythm is something that we should really be looking at really seriously. It's a real challenge. From my own experience, a few years ago, we were looking after my father-in-law who was losing his cognitive ability. And he didn't like going to bed on a night. So he used to sleep fully dressed in his reclining chair, despite no matter what we did. We bought him a very expensive, lovely adjustable bed, wouldn't go in it. Went in his reclining chair, fully dressed. He had no idea when night and day was. So he was in his reclining chair, not really able to reposition very well. We would be combing the streets for him at 2 o'clock in the morning because he thought it was 2 o'clock in the afternoon and he was going out to get his paper. He didn't have any idea of day or night. So giving patients really clear habits and being really firm with them sometimes around what we need to do before they get into really bad habits is really important. Making sure that they have those nighttime routines, making sure that they are getting out or getting some daylight in the morning, which switches on the circadian rhythm in their eyes, in their brain, ensuring low light in an evening, reducing devices if they are on devices, or even just reducing the overhead bright lights. Reduce unnecessary nocturnal disturbances. Now, if you don't take anything else away from this talk, please, 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 if you have women over the age of 45, anybody who does not have an active estrogen receptive positive breast cancer, they're the only exclusion. Please give them vaginal estrogen. Women are going to lose urethral competency as they get older, as they get postmenopausal. It is avoidable. Vaginal estrogen can help fix that. We know, don't we, if they have any kind of stress incontinence, then that urine is going to sit on their skin. And then if they get any kind of pressure damage, the urine is going to burn. They are going to get pressure sores. It's going to be a living nightmare for them. It's going to be horrific for us as healthcare professionals to manage. If we give them vaginal estrogen, and I still maintain the government should send everybody a tube of it when they're 45 years old, this is largely avoidable. Vaginal estrogen helps restore the skin integrity in the intimate areas. It helps reduce burning, it helps reduce skin tearing, dryness, soreness, all of those kind of things, and then can really help reduce the chance of that skin damage in areas where pressure goes. So vaginal estrogen, say, unless somebody has an active estrogen receptive positive breast cancer, they are, or estrogen receptive positive cancer, they are a candidate for vaginal estrogen. If they've had cancer and that's fully resolved, they are still a candidate for vaginal estrogen. It's extremely safe, so please don't be afraid to introduce that into your female's skincare. And magnesium bisglycinate. So I have a lot of patients that come to me and they love their supplements and things like that, and they'll say, "Oh, I've heard lots of really good things about magnesium, so I'm taking it." And we'll dig a little bit deeper. And 90% of the time, because it's the one that is most commonly sold, they're on magnesium citrate, which is an excellent laxative, but it's not really great for sleep. Magnesium bisglycinate is the one if we are looking for muscle relaxation, calming the central nervous system, and helping promoting sleep. So patients would take this on an evening because it does have slight sedative properties, and it can help again maintain that circadian rhythm so that we can differentiate night and day, so that we can make sure that they're getting that proper restful sleep and that healthful sleep that's helping with repair. So, stress and psychological health, like I already mentioned, and I'm sure we know, chronic stress raises cortisol. That suppresses immunity and increases inflammation. So, we need to help educate our patients and take them from those stress responses, which are constantly often in fight or flight, and get them back down to rest and digest. One of the very interesting things that we did during COVID, if anybody was on intensive care during COVID, patients would come in extremely sick. We would sedate them, we'd tube them, we'd take them to intensive care, and then we would prone them. And the reason that we would prone them is so that we could ventilate their full lungs. Now, for them, for COVID, that's because we really, it's a lung disease, isn't it? But when people are in fight or flight, what they are doing is often breathing really apically at the top of their lungs. That's releasing the cortisol. That's increasing systemic inflammation. If we can give our patients really simple breathing exercises that teach them to ventilate their full lungs and breathe right the way through their lungs, so when they're taking a breath in, their abdomen's expanding, that is going to take them from fight or flight into rest and digest. It's going to mean that they can sleep better. It is going to mean that they are producing less cortisol, and it's going to reduce their overall inflammation and increase their immunity. So it's a really powerful thing to do. A lot of people think it's a really woo-woo to talk about breathing exercises. The reason that I mentioned about proning people is that if you have patients that really struggle with those breathing exercises, and I'll be honest, it took me ages to learn how to do them properly myself, actually just proning them or getting them to lay on the tummy and breathe that way, if they can, actually really helps ventilate the lungs properly. You cannot breathe apically if you are proned. And really understanding what brings our patients stress and what brings them joy. So by bringing joy, we're releasing positive endorphins. Again, we are reducing inflammatory processes that affect our entire system, including our skin. So really helping them to find their happiness and reduce their stress. And if bringing in the multidisciplinary team that we need to do that, maybe it's clinical psychology, maybe it's various therapists, but we need that as part of our treatment plan. So avoidance of risky substances, as we know, as we've already said, even smoking, it constricts the microvasculatory system, and it delays healing. So we know that that's a bad thing. We're always going to tell patients that's a bad thing. We know that alcohol is also a bad thing. It's terrible from a nutritional point of view. It will massively increase blood sugar, which will increase inflammatory processes. So we've got services that we can send patients to support them. But we need to provide options to fill the gaps. And this is where we often fall down. So we'll say to patients, you need to stop smoking. Here's the smoking cessation service, and off they toddle. Now that's great, isn't it? And if they come back 2 months later and say, oh, yes, doctor, or yes, nurse, I've done great. What I've done is I've not smoked for 2 months. It's fabulous. You'll be dead proud of me. But the heroin is amazing. The point of that is if we are creating a gap, we need to fill that with something better than what we've taken away. So we need to give patients strategies, and that could be hobbies, that could be exercise, it could be social engagements, but we need to give them strategies to fill the hole of what we are removing, because otherwise we are creating a gap into which they can bring something even worse than they were dealing with previously. So it's just something to be really aware of. Social and spiritual connection. Really, really important is this, having a sense of purpose. Loneliness is a horrific disease. People who are lonely, they generally can't be bothered. They're not going to adhere to a treatment plan as well. Their recovery is going to be slower. We know that people with loneliness actually suffer with 40% all-cause mortality greater than people who aren't lonely. And they're going to be less engaged in their overall rehabilitation, whatever that may look like. So we need to be asking the questions: who supports you? Who helps you at home? Who do you socialize with? Um, what communities are involved in your life? And if we find that they are lacking, then we have places to refer to. We can refer to chaplaincy. They don't have to be religious people. Chaplaincy offer just social and spiritual and community support. We can look at social prescribing possibilities and peer groups. And most important of all, in and amongst all of this, even when we're talking about skin, please think about your patient's ability to hear. We know that hearing is the number one indicator for the development then of Alzheimer's disease, because people are isolated and then they lose their cognition. And again, once cognition starts going, then we've got other issues going on, which will often impact on skin. So the simple thing of making sure the patient's screened properly for hearing can have such a massive knock-on effect. So we know that steroids cause problems, don't we? Systemic steroids, topical steroids, they're going to reduce the dermal epidermal junction. They're going to reduce collagen production. Overall, the skin is going to become thinner, drier, less hydrated. We can see if we use the right tools, flattening of the DEJ there. We can use skin scanning, skin hydration measurements, Woods lamps. A lot of these are maybe more widely used within private practice, but we can also use our eyes and just really assess what's going on there with the patient's overall skin health. And certainly we need to be looking at medications that can influence that. So polypharmacy, I'm sure it's already been discussed today, but things like statins, ACE inhibitors, calcium channel blockers, these are all linked to degenerative skin conditions. Diuretics, psychotropics, these will impact our overall lipid balance and the overall hydration. So we need a really good medication review to make sure that we're not giving patients things that aren't entirely necessary, particularly when they've got chronic skin conditions. And these, may well be medications that aren't related to their skin. Do they need them? Can we get rid of them? Can we change them? Could we use something else? So topical agents, I noticed certainly in the last presentation we were talking about different dressings and topicals. For me, this is very much, let's really understand what our active ingredients are. We don't just want to be talking about brands. There are lots of products out there. And niacinamide is my hero product, so vitamin B3. That is anti-inflammatory, it's antioxidant, it enhances barrier function. It does all kinds of things. And if we can be getting patients using these as part of a skincare routine before we see problems arising, then they are going to help mitigate problems, or certainly make problems easier to manage when they do arise, if the patient's already got fundamentally healthy skin. So we can use semi-occlusive dressings as well, that's previously been spoken about, to maintain that moisture balance. And also, obviously, as you are very, very well aware, barrier creams and emollients that are for that very fragile skin. Please make sure they're not irritating though. We do need to understand what is in our products, and there are a lot of different aqueous creams and things out there that actually have quite a lot of irritants in them. So don't just look at the brand, please look at the ingredients and understand what these ingredients are actually doing. And again, vaginal estrogen. I'll just say that again just for fun. The brain, gut, skin axis. So what's going on in our gut is going to be reflected in our skin. If there are problems in the gut, it will be visible on the skin and it will drive inflammation. So cytokine release also is going to drive inflammation and cause skin problems, potentially acne, psoriasis, eczema. The gut, brain, skin triad that operates via the vagus nerve. So the vagus nerve connects directly between our brain and our gut. And we know this, don't we? Any of us that have had those butterflies in your stomach when you're approaching something that's a little bit nerve-wracking, we know that there's a very strong connection there. We know the gut bacteria needs to be a healthy gut bacteria in order to keep us nutritionally optimized. And all of this does affect our immune and endocrine pathways as well as our overall skin health. So things that we might do from a lifestyle intervention factor, and sometimes this is quite difficult to do in the NHS world because some of these are things that we can't actually prescribe. But a really good fibre, high fibre diet. Horrific if a patient's an inpatient. Actually, our hospital food isn't great at all, is it? And it's certainly not got anywhere near the amount of fibre that we would want for patients to actually have to improve their overall gut health. Omega-3s can be really, really good, can certainly help with skin, help with cognition, but is a supplement. So again, not something that we would generally prescribe as such, but we can absolutely recommend that a patient uses it. Recommending things like fermented foods that can really help with a variety of different feeding of different gut bacteria. Using mind-body practices, and again, going back to these breathing exercises, this improves the vagal tone. It helps us to switch out of these states of fight or flight into rest and digest. So really simple strategies. And if the patient isn't up to deep breathing exercises, simple things like reading a book that they enjoy and giving themselves a little bit of time out to escape the real world into their own head of a book or things like that. That is a kind of meditation. So we can still advocate for them in really simple ways. Topicals, like I say, niacinamide is brilliant. Ceramides, we know all about. Probiotics. So generally speaking, if somebody's nutrition isn't optimized, their gut health is suboptimal too. Pre and probiotics can be absolutely critical in helping improve this balance. So prebiotics, for those of you who maybe aren't quite clear, are the food for the probiotics. So this is a supplement somebody would take in the morning, maybe about half an hour or so before they have something to eat. I am mindful of time. I will be stopping shortly. Half an hour before they have something to eat. So the good gut bacteria is already in their gut waiting for the food to come in. We need to obviously be measuring things like transepidermal water loss. We need to look at psychological stress scores. We need to be monitoring the patient in a really, truly holistic way. So just as to sum up really as a clinical case study, this particular lady, she was a 60-year-old lady with long-term corticosteroid use, and she had lots of polypharmacy going on, and she had therefore lots of dry and itchy skin conditions. We switched up her diet. We looked at her medication and saw what was absolutely necessary and what wasn't. We introduced pre and probiotics. We introduced products containing niacinamides and actually semi-occlusive niacinamide products there and emollients. And she actually had a measurable improvement in hydration and reduced flare and frequency of her skin complaints. So I've mentioned how we can clinically measure how we are improving overall skin health. Obviously, no surprises there, but maybe we do need to be looking a little bit more at these anxiety scores because that will have a direct impact. So just in summary then, we need to be reviewing all medications for their risk to the skin health. We need to be mindful not just of the skin, but the gut and the brain as well, and weave that entire triad into their care. Look at all of the inflammatory processes that are going on, not just the actual wound that we might be looking at, but get that upstream before a wound arrives and look at reducing inflammatory processes systemically. Use these evidence-based lifestyle therapies in line with the pillars of lifestyle medicine. And I can't stress enough, these aren't woo-woo, these are evidence-based. There is tons of research out there. And then we really do need to monitor and personalize the interventions. A one-size-fits-all approach will not work in this particular case. So that was very much a whistle-stop tour. Here are the references I have used. This is me, and I'm not sure if we've got time for questions, Sarah, but I will stop talking now.
Yes, yes, we've got time for questions. Thank you. If you want to stop sharing your screen when you're ready, that's
Of course, yeah.
great. We haven't had a lot of questions in. Sometimes when we start talking now, people start adding them in. Really fascinating stuff. It sort of reinforced the importance of holism,
Yeah.
which as healthcare professionals, that's what we should be doing. And I know that there are barriers to that sometimes in terms of the time that we're allocated, the nature of what we do, the lack of continuity, which is all really important. We have to get to know our patients well, don't we, to be able to sort of implement or to support them with some of these sort of principles. Someone's asked a question about the impact of things like steroid inhalers on the skin. I assume that needs to be taken in consideration as part of that medicine review.
Yeah, absolutely. And of course, if people need to breathe, that's going to take a priority over their skin health. Um, it isn't as systemic, is it? Inhalers are working sort of very locally where they've put, but equally your lungs are connected with the entire rest of your body. So long-term use, yes, we would expect to see some impact there, but it by no means the same level of impact that we would expect to see from topical steroids. It's definitely something to be aware of, though, because if again, moving slightly away from skin, but if somebody is using inhalers, they have got a chronic airway issue of some degree or another, which will be driven by inflammation. So if we can reduce their systemic inflammatory processes by some of the other processes that I've mentioned, then actually they may not need to use that preventative inhaler as often as they did previously.
Yeah, I mean, I know where you're coming from, Casey. A comment about it'll be very difficult to practice in the NHS because she's only come across a handful of patients that don't think it's woo-woo. And I think that's a huge barrier, isn't it? But I mean, some of what you've talked about, yes, it probably will be difficult, but there's also a lot that we can do through conversation. I love the bit about the breathing because I
Yeah.
think that's been quite powerful for me when helping people manage their wound pain.
Yes.
So we've done a lot on breathing and things like mindfulness as well, like distraction therapy. And some people might feel uncomfortable doing that, but it does work if you can get that right.
It 100% does, and it has real physiological impact. And I think the problem that we've got is historically patients are so used to being the patient and being treated by the medic. Lifestyle medicine is all about patients taking responsibility for their own health journey and putting them in the driving seat. And I always say to my patients, what I do is a part of a jigsaw puzzle. And I might provide you with one piece, but it's what you're doing with all of the other bits of information that I give to you that are going to complete the picture. And that's really important. So it's about empowering our patients and also making them responsible. Because often it's very easy, isn't it, to doctor says, and it's doctor's fault if it doesn't work. And it's about a complete mindset change.
Yeah, absolutely. There's Jordan said they use these sort of principles in palliative care.
Yeah.
It's at the forefront of what they do. And even though it's their first post, they hope to take these principles wherever they work. And that's it. It's about how we educate our workforce. This
Mhm.
sort of stuff wasn't covered when I was in nurse training. And in fact, a lot of training that I still undertake, we don't. And we can't supposed to be experts, but it's as you said, it's taking a little bit of the jigsaw and how we can use that in care, I suppose.
It is, and we can use tiny, tiny little bits. We don't have to do everything all at once. We can just have that little conversation and just give patients one thing to do at a time to change. Even say something as simple as adding in an omega or throwing in some turmeric or things like that. So it's tiny little incremental changes that all build to give a bigger picture. And I appreciate it's hellishly difficult in the NHS. But if we can just take these small things and bring it into everyday practice, it will eventually become much more normalized.
It is difficult in the NHS, but it goes back to what you say about people taking responsibility for their own health. And I know I could probably hear people sighing and going, yeah, we know, but people don't. And that's why they're known to our services. And
Mhm.
it is really frustrating because we know prevention is better than cure. But I think often it's about motivation, isn't it? And when you've got somebody who lives in an environment that's not great, they haven't got a lot of money, they're overweight, they're lonely, they've whatever, they lack that motivation. So a part of this surely has to be around that, how we support people with trying to motivate, finding some little chink in their life that maybe is something to aim towards.
Well, also it is about putting them in control, but a part of that is a lot of these patients will be really anxious patients.
Yeah.
And anxiety often stems from feeling out of control. So if we can then give them little bits that they can be in control of incrementally, that will build. And I think we will see it over the next couple of generations. I think we're now sort of at the end of we're kind of the post-war generations that are our elderly populations are very much the old school people. We're seeing younger people are much more empowered, much more informed. So I think we're in a bit of a unique place at the moment where we are on the cusp of big change. And if we want to be ahead of the curve, now is the time to jump on board and get really informed about all of these things. But I
Yeah, I
totally
mean,
get what
in
Casey is
terms,
saying.
yeah, and in terms of things like diet, I
Mm,
mean, I'm thinking about the older people that I work with. If I, recommended a ginger and turmeric shot, for example, I think they, would look at me as if I'd gone completely mad. But we
yeah.
know that, as you say, this younger generation, they get that because they're doing it already. I'm just aware of time, and I would really like, in terms of lifestyle medicine, um, and the work that you do with the NHS. I mean, where can people go for more information? Is things like, lifestyle medicine commissioned by NHS Trust to support them? How can people find out a bit more?
So there are so British Society of Lifestyle Medicine have an amazing website with tons and tons of training on there, and you don't have to go straight for the board certification, which I can tell you is quite substantial. But there are lots of little modules on there that you can do, so you can just pick and choose. They have an amazing conference every year. Unfortunately, it's a 3 day conference, and unfortunately, it's unlikely that many people will be sponsored by the NHS to go on it, but there are people. So sorry, Louise, the website is the British Society of Lifestyle Medicine, BSLM dot, it might be .org, but if you just Google British Society of Lifestyle Medicine, it'll come up. So I would start there if you're interested in the training. The conference that's actually coming up at the end of this week is an annual conference. It's a 3 day conference. We have lots of people from the NHS speaking at that, as well as private practice. And people that are interested are funded to go on it. I see less nurses funded to go on it than I do doctors, unfortunately,
Mm,
which is a real shame because I think it's nurses that probably have the most consistent patient contact
yeah.
and have the most potential to influence behaviours.
If you don't ask, you don't get, folks. So, if there's a conference and you're interested in this, you can use these principles in your patient care. Just ask. You never know. They might say yes. But it was fascinating, Tracey. Thank you so much.